A lot has changed in these past months all around the world. Small businesses have broken down, governments are operating with uncertainty, and social life has found a new way to thrive. In 2020, COVID-19 affected almost every country around the globe. Uncertain of how the situation will develop, many people, businesses, governments are faced with difficult decisions and obstacles to overcome.
Every crisis management is based on three standpoints. The first one is the time frame, since we have to decide and take decisions in a very limited time. The second one is trust building. Without it, it's impossible to manage the crisis. And the third one is creating capacities with whom we can handle the crisis in our area, in this case, in our municipality. So all these things has to work hand in hand if we wanted to create possibilities and capabilities to manage successfully the crisis. In case of municipality of Kočevje, as I said before, it is the largest municipality in Slovenia that covers 555 square kilometers and is approximately 60 kilometers from the capital of Slovenia, Ljubljana. We had the first case of COVID-19 reported in March 2020. When we had this kind of phenomena also in our municipality, we started to develop and design our capacities to fight the crisis. Our government in Slovenia decided in the first wave to create a total lockdown. That meant that all schools, all factories, all production lines and all members of administration were cancelled for the time being. Over 4 weeks, people were not getting to work, they were not involved in educational program, and they stayed at home locked with their families. When this was done, a lot has to be organized in order to support this kind of a lockdown in our municipality. We, as the administration, municipal administration, decided to create capacities that were resting on 4 pillars. The first pillar was the health system that we worked hand in hand. The second one were volunteers that were needed to take care about vulnerable members of our society. That meant bringing food to their homes and bringing pharmaceuticals to the people who were in need. The third pillar were the free volunteers, firefighters, who supported the system by being present in organizing and focusing on people who were at home. And the fourth pillar were us, the municipality administration. With very closely cooperation, we were able to fight this crisis in our town, and I can say that within 4 weeks, the spread of coronavirus, COVID-19, did not happen in our municipality.
But the story doesn't end here. Before the pandemic reaches its end, there is one last obstacle: vaccination. It's the light at the end of the tunnel.
In the second wave of fighting COVID-19 in Slovenia, our government did not afford itself to lock down the whole society for additional 4 or even more weeks. So we have to redesign our system, also in municipality, in the way to live with COVID-19 being present among our members of local community. In that way, we organized a special system that was based on mass testing, not in our health center, because we would like to not to have those two populations in one place. So they were tested in other facility, and this was our sports center that was equipped and designed for this kind of needs. But this was then upgraded also for the needs of vaccination process. We are really happy and proud on our system, since it was the best working system in Slovenia as such. By this date, we already vaccinated approximately 30% of our people in municipality, what is the most successful result in our country. That was possible only through very tight cooperation between our health center in municipality and designing a special IT support that enable us tracking down all people who should be vaccinated when and how. So we are a very good example of successful fight against COVID-19 in our municipality, but then again, it was only possible because we worked together hand in hand and we helped ourselves in this way.
Primary Health Care Center in Kočevje takes care of approximately 17,000 residents in 3 municipalities, Kočevje, Kostel and Osilnica. The area is huge and rural. Although scientists are working hard, we still don't have cure for COVID-19. Vaccination is our best weapon against pandemia of COVID-19. Disease is unique in its fast spreading and many possible complications and unnecessary deaths. Vaccination can prevent spreading of the disease. Vaccinated persons don't get sick or just get a mild version of disease. It is crucial to stop pandemia in further spreading. As in many other medical procedures, side effects are possible. Some are common, such as redness or pain at the point of application. Others are rare, but serious, such as thrombosis or pulmonary embolism. We, as medical professionals, always consider safety first, and we count costs and benefits of every procedure. At this moment, benefits and profits of vaccination are far bigger than potential risk of side effects. We are happy that our vaccination process goes on fluently. We have already vaccinated over 30% of our residents with first shot and over 12% with second shot, and are continuing this process in following weeks and months.
In the end of November 2020, we developed our own software for collecting data. All our employees have access and they could sign in anyone who wants to be vaccinated. We put all the puzzles together and finally we have the strategy. We had 2 main goals: to vaccinate as many people as possible in short amount of time and to do vaccination safe. Drive-in system for vaccinated people is safe, fast, comfortable, especially for old people. Our drive-in system contains check-in, where our staff check identification, 2 vaccination points, recovery on a big parking lot, and emergency medical service in case of severe allergic reaction. In Kočevje we have vaccinated over 800 people in only 1 day. These days Kočevje is at the top of Slovenia in terms of population vaccination. It is essential that the number of people who have been vaccinated with at least 1 dose of either vaccine is increased as quickly as possible. We are dealing with 70,600 citizens, approximately 2,000 under 18 years old. More than have already received the first dose. This represents about 35% of the country's population. And among those over 60 years old, more than 80% have already been vaccinated. The number of infections is falling, especially among people older than 60 years old.
Kočevje je gasilsko društvo 4. kategorije posebnega pomena. Delujemo tako na ravni občine kot na ravni države. V času, bomo rekli, korona situacije naše delo poteka nemoteno z dodatnimi nalogami, kot so razkuževanje, pomoč pri prevozih vzorcev vsakodnevno v Ljubljano, to traja že od meseca septembra, in pa pomoč na samem cepilnem mestu, kjer izvajamo službo rediteljev, pomagamo urgentnem osebju pri oskrbi oziroma pri spremljanju stanja teh, ki so bili že cepljeni, kaj se z njimi zgodi v roku pol ure, in skrbimo za varnost.
Prostovoljci Rdečega križa pomagamo pri zaključku na cepilnem mestu, v bistvu potem na koncu, ko so ljudje cepljeni, se pri nas javijo, jih malo pomirimo, damo še dodatne informacije in jih prosimo, če še 20 minut počakajo na parkirišču, da v bistvu se razvije ali kakšna alergija ali kakšna slabost, v glavnem tisto trenutno po cepljenju. Drugače pa širimo dobro voljo, nasmejemo se, pozdravimo ljudi, marsikoga že dolgo časa nismo videli in je to eno prijetno druženje, Načeloma smo prejšnji teden tudi zaprosili ljudi oziroma otroke v vrtcih, da so narisali risbice in smo tudi to razdelili, tako da si v bistvu iz cepilnega mesta proti domu odšel zadovoljen, dobre volje. Smo pa zelo lepo sprejeti in ljudem te besede veliko pomenijo. Na cepljenju se nas izmenjuje okrog 5 do 6, se pravi ob četrtkih, ko se cepi, ali petkih, vsakič je nekdo drug prisoten, tako da se izmenjujemo. Delamo pa od začetka, se pravi od okrog 8:30 pa tam do 7 zvečer tudi, če je pač večje število prijavljenih na cepljenje.
We must provide support to online education, to health services during the COVID-19 crisis with the involvement of volunteers, and to local businesses.
I am Alexander Jevšek and I'm mayor of City Municipality Murska Sobota. In December 2020, the City Municipality of Murska Sobota and the Students' Organization established the Community Assistance Center Murska Sobota. I'm very proud about our students and I'm looking forward to meet you and to present this good practice in our meeting.
My name is Vladimir Prebilic. I'm a mayor of Municipality of Kočevje from 2010, so I'm finishing my 3rd term. I would like to present you more about how municipality can organize ourselves, what kind of support can be developed and designed in order to successfully fight the crisis with the COVID-19 in case of municipality in Republic of Slovenia.
My name is Jasna Gabric. I'm the mayor of City Trbovlje in Slovenia. At the panel, I present how we support the businesses on the local level and as well the impact of the state support. And what kind of impact does this help have on the unemployment rate?